Good morning, everyone, and nice to meet you. First of all, I'd like to introduce myself. I'm Maddalena Iodice. I'm nurse and midwife, and I work in a National Agency for Regional Health Services, and I'm from Italy. My office is called Digital Health and Telemedicine Unit and consists of a multi-professional team. This abstract, called Family or Community Nurse and Telenursing to Support Home Care, was produced by our working group, whose authors' names appear on this slide. Following the coronavirus pandemic, which profoundly affected the entire country, showing the significant critical aspects of our system, the Italian government approved the National Recovery and Resilience Plan, in Italian known as PNRR, to relaunch the economy and promote health, sustainability, and digital innovation at the same time. National Recovery and Resilience Plan is part of the European Union program financed by Next Generation EU fund. And the Next Generation EU is an investment fund for EU member states, and it amounts to 750 billion euros. It also known as the Recovery Fund, and the Recovery Fund gives Italy a total of around 119 billion euros. National Recovery and Resilience Plan is the Italian instrument for planning investment to be realized by 2026, financed by this fund. National Recovery and Resilience Plan is a performance-based investment plan. This means that in order to unlock funding, it is essential for the country to achieve targets and milestones planned at the European level, respecting all the deadlines that have been planned and shared with all the Italian regions. The deadline by which Italy commits to reach all targets and milestones is 2026. The plan is divided into 6 missions, each of which is split into components. In total, National Recovery and Resilience Plan consists of 6 missions and 16 components. Mission 6 is called Health and is divided into 2 components. Component 1 is called Proximity Networks, Intermediate Structures, and Telemedicine for Territorial Healthcare. Around 7 billion euros are planned for Mission 6, Component 1. National Recovery and Resilience Plan promotes an ambitious reform agenda. Each mission of the National Recovery and Resilience Plan includes at least one reform. In Mission 6, called Health, Component 1, the reform promoted by National Recovery and Resilience Plan is called Definition of a New Organizational Model of the Territorial Healthcare Network. This reform was ratified by Ministerial Decree number 77 of 23 May 2022. The reform represented the achievement of a milestone of European relevance. The decree on the reform of territorial healthcare is called Regulation Defining Models and Standards for the Development of Territorial Care in the National Health Service. This decree represents a real reform of Italian territorial healthcare because it defines staffing standards, organizational standards, technological standards, and facility standards in order to improve the national health service. It introduces innovative organizational models that aim to increase the rate of care at home, which is privileged place of care, also through telemedicine tools, reduce inappropriate access to emergency rooms, reduce long-term hospitalization whenever possible, reduce inequalities and inhomogeneities in access to care throughout the whole country. The reform decree also stipulates that the management of territorial health care should be performed with a view to multidisciplinarity, proactivity, and initiative medicine. Another relevant aspect stressed by the reform decree is the increase in social and health integration. So, the innovative organizational models that are proposed by the decree are planned to be networked and interconnected in order to ensure a more comfortable continuity of care for the patient in the transition from hospitalization to taking care at home or in community facilities. The main theme of the reform decree is the promotion of holistic care based on the World Health Organization's One Health principles, integrated, unified, and sustainable approach to health. According to these principles, the National Health Service is seen as part of a welfare system in which digitalization, ecological sustainability, and prevention are fundamental building blocks. First of all, the National Recovery Resilience Plan Health Reform Decree describes and defines standards of a health district in Italy. Health district is an organizational functional articulation of the local health authority in the territory. The district is the place for the management and the functional organizational coordination of local health and social services network. The district is responsible, also through the community health house, for pursuing integration between the various healthcare structures. The district guarantees an integrated care response in terms of resources, tools, and professional skills in order to ensure effective care for the target population. The functions of health districts also include home care. According to the principles that inspired the National Recovery and Resilience Plan and the Reform Decree, the home is the first and privileged place of care and setting for people who do not require hospitalization and who are not in an emergency or acute condition. Home care involves the provision of services characterized by a variable level of intensity and complexity. Home care can be provided by a multi-professional team that goes to the patient's home, but it can also be provided through the use of telemedicine tools. The presence of health staff is secured 7 days a week, all day long. The target set by the reform decree is to take at least 10% of the population over 65 years of age in home care in each region of Italy. To achieve this, in National Recovery and Resilience Plan is financing the investment with 2 billion and 917 million euros. Achieving this goal is a European target. It will be necessary by the second quarter of 2026 that at least 842,000 more people over 65 years of age are taken into home care. In this context of primary care reform, a new professional figure for the Italian national panorama is inserted, which is the family or community nurse. The figure of the family or community nurse was introduced by the World Health Organization in the year 2000. In Italy, this professional figure was introduced in 2020, and until 2021, in Italy, the reference staffing standard for family or community nurses was described in Decree Law number 34 of 2020 and was 8 family or community nurses for 50,000 inhabitants. Then, in 2022, Ministerial Decree number 77 is being decisive for the family or community nurse, because this decree redefines the staffing standard for the family or community nurses. And it is one family or community nurse each 3,000 inhabitants. This standard is to be understood as the total number of family or community nurses employed in the different care settings in which community care is divided. The role of the family or community nurse is the first and foremost part of the functional cooperation of the figures that form the multiprofessional team. And according to the National Recovery and Resilience Plan health reform, the nurse is the referent of the response to care and self-care needs. It considers among its activities the prevention and promotion of health in taking care of the individual and of individuals' relational network. Nurse is in contact with the actors of the process, and nurse is of support for the patient in the different phases of the taking care. In the reform decree, the family or community nurse is defined as a professional who has a strong orientation towards proactive health management and covers different functions, providing healthcare services depending on the setting in which the family or community nurse operates. The family or community nurse is active in facilitating and monitoring pathways for the taking care and the continuity of care, in strong integration with other professional figures in the territory. Finally, another investment financed with the National Recovery and Resilience Plan fund, and which is included in the Italian Territorial Healthcare Reform Decree, is about telemedicine. Italy is implementing a national telemedicine platform, and this process is still ongoing. The deadline for this investment is 2026. The target population consists of patients with chronic diseases belonging to 5 clusters: oncology, pneumology, cardiology, diabetes, neurology. National telemedicine platform will also have to be integrated with the digital health ecosystem and the electronic health record. Telemedicine services include telenursing provided by family or community nurses. So, what is the impact of telenursing provided by family or community nurses on home care in Italy? National Recovery and Resilience Plan finances investments in telemedicine with the 1,500 million euros, which include telenursing provided by family or community nurses, and investments in home care with 2,970 million euros. The governance of these investments has been set through the activities of the expert working groups, which defined the technical and IT features of telemedicine and outlined the guidelines for the implementation of digital home care model in Italy, ratified by ministerial decrees of 29 April of 2022 and 30 September 2022. Instead, family or community nurse staffing standard necessary to assure implementation of these investments was estimated considering the services offered, operating hours, and catchment area. According to National Recovery Resilience Plan reform, the reference standard is one family or community nurse each 3,000 inhabitants. So, by 2026, at least 300,000 people will be assisted through telemedicine tools. As telenursing, with taking charge at home of at least 10% more of population over 65 years old, estimated at least 842,000 people, as planned in National Recovery and Resilience Plan reform. So, in conclusion, Italy is investing in strengthening primary care and digitalization of services. Telenursing aims to guarantee proactive, personalized, and proximity care, enhancing home as a privileged place of care. Family or community nurses perform health monitoring, assessment, promotion, prevention, and education by telenursing in order to reduce inappropriate hospital admissions and to increase patient satisfaction, safety, and empowerment. Thank you for your attention, and I remain at your disposal for any questions.